Hello, my name is Andrea Duart, and I'm going to be doing my skin, hair, nails, and abdomen assessment. This is my work badge on, and I'm going to have my test student read the statement while you do a room scan and set up my camera. Go ahead.
I, Leonard Duart, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted at the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore, Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any of their devices as soon as it has been reviewed by the graded instructor.
Thank you. Okay, so I washed my hands. I'm going to knock knock. Hello, my name is Andrea.
Hello.
I'm going to be your nurse practitioner today. I'm going to be doing an assessment of your skin, hair, nails, and abdomen. Can you tell me your name and date of birth?
It's Leonard Duart, 5'11", 73.
Okay. So I'm going to start off by doing a general survey of your skin of what I can see. I'm looking for any obvious signs of moisture or dryness, such as sweating, diaphoresis, or dry patches. I'm just kind of generally touching for temperature. You feel warm, dry. I don't see any lesions of any type. If I did, I would note the size and the characteristics of the lesions. I'm going to take a look at your scalp. I'm looking for lesions. I'm looking for any patches of hair that didn't have even distribution. You have normal hair distribution where you grow hair, and I don't notice any lesions or obvious skin deformities or anything like that. And can I see your fingernails? I don't see any signs of clubbing or any other abnormalities. If you can do what I do, put your knuckles and then your nails together. I see a good angle in here indicating that you don't have clubbing. Before I have you lay down for your, this is kind of out of order, before I have you lay down for your abdominal assessment, I'm going to test you on your back for tenderness that might be related to your kidneys, which is pain at the costovertebral angle. I'm going to have you kind of rotate your knees that way, so you're going to view the camera. And I'm just going to locate your last rib and then tell me if you have any pain.
No.
Okay,
No.
perfect. So no pain or tenderness
No.
there. So I'm going to help you lie down for the next, yeah, perfect. So initially I'm just going to take a look at your abdomen. The color is normal for your ethnicity, and the contour is protuberant. I do notice that you have a little bulging near your belly button or umbilicus, as well as a surgical scar there.
I've had hernia surgery and I have a hernia currently.
Okay. All right. Other than that, though, I don't notice any lesions. As you're breathing, I notice even and regular movement of your abdomen. I don't see any pulsations or anything abnormal on inspection. Next, I'm going to take a listen to your bowel tones with the diaphragm of my stethoscope. Okay, good. I'm going to switch to the bell and I'm going to listen to some vascular sounds. Okay, so I heard normal active bowel tones through all 4 quadrants. If I didn't hear that, I would listen for about 5 minutes to see if you had any bowel tones. I did not hear any bruise over your femoral, iliac, renal arteries or your aorta. And I did not hear any friction rub over your liver or your spleen. Next, I'm going to do some percussion. So I'm just listening for equal resonance. So I hear tympany throughout. If I did hear some dullness, that would likely be due to being over an organ or perhaps a mass. Next, I'm going to percuss your liver span. So I do have a skin marker I'm going to mark on your skin with. So I'm going to start mid-clavicular and lower, and I'm going to palpate, or I'm going to percuss up until I hear dullness. Right there. This one pushes off. And then I go from the base of your lung down until I hear it as well. And I'm going to measure that. And that is 6.5 centimeters, which is normal. 6 to 12 is a normal size. And then I'm going to be percussing over here. If you can take a deep breath and hold it real quick. Okay, good. I didn't hear any change in the sound or the, which might indicate splenomegaly. Now I'm going to lightly palpate your abdomen. Let me know if you have any tenderness, okay? Any tenderness?
No.
Okay. I'm going to go more deep this time. You let me know if you have any pain.
No. No. No.
Okay,
No.
perfect. So I didn't feel any muscular tension or masses or anything there. I'm going to attempt to feel the edge of your liver here. Take a deep breath for me. Okay, let go. Again. Okay, perfect. Now I'm going to try to palpate your kidneys in. Okay. And again. Okay, perfect. So I wasn't able to palpate your kidneys, which could just be a normal finding. But again, I didn't feel any masses or anything like that. And we already checked for the tenderness over your kidneys while you were sitting up. So I'm going to test for some things that we would normally do if I had suspicion for appendicitis or other abnormalities. So the first thing is checking for tenderness over McBurney's point, which is between your umbilicus and your iliac crest, so about 2/3 down. So let me know if you have any pain. Any pain there?
No.
Okay. And how about when I let go?
No.
Okay, so no rebound tenderness. Now, Rosving's sign, I'm going to press over here on your left. Do you have any pain on the right?
No.
Okay, and then I'm going to press my hand here on your thigh. I want you to lift your leg up against me. Any pain there?
No.
Okay, so that is a negative psoas sign. The last one for your appendix I'm going to do is I'm going to have you bend your knee. Perfect. Relax this. Now I'm just going to rotate this out and then down, around. Any pain there?
No.
So your appendix lays over your obturator muscle, so any kind of manipulation or rotation there would probably cause you pain if you did have any inflammation to your appendix. And then the last test I'm going to do is I'm going to palpate up here. I'm going to have you take a deep breath and try to palpate, see if you're, okay, go ahead and let go. If your gallbladder was inflamed when I palpated, you would likely have some pain. And I think that is all.